This is a highly edited version of a case I did on a patient who had a bound-down pupil. The patient was also on Flomax. And basically want to show this just to show that these cases can be done safely with just a little modification to our normal cataract technique. Obviously, because of the small pupil, the pupil's got to be expanded. With Flomax, we'd rather not use a beeler or anything to stretch the iris like a beeler, so we decided to use iris clips just to pull the iris back and keep it in good position. So the case begins with the performance of a number of small paracentesis sites where the clips will be placed. In this case, because the pupil is so small, we're going to use 5 clips. Actually, have come to almost prefer using 5 clips on Flomax pupils that don't dilate. And you can see up at about 2 o'clock there's a PI that's been done because of the fact that this patient's pupil was bound down. That actually will show up better when you get a little red reflex later in the case. And now the main incision site is being made. This is made with a 2.65 keratome. I actually today would prefer using a mix approach, using maybe a 2.2 or even a sub 2 millimeter opening, just because I think it's better in the setting of a floppy iris. The iris just really doesn't move much. Of course, with clips, we're going to keep the iris movement down to a minimum. Here you see the clips have almost been placed. We're going to post a longer version of this, so you can, if you really want to see some of these little maneuvers and how they go. Here, this performing the round capsulorhexis. Very easy to do this. We're doing it. We always do this under viscoat. That's our preferred viscoelastic for these cases. And once the capsulorhexis is performed, our routine phaco flip is done. And this just shows that following that we have a nice capsulorhexis. The lens goes into the bag. And with the soft port insertion system from Bausch & Lomb, it's really easy to put this lens nicely into the capsular bag. And you see the nice overlap of capsule at the end of the case.